So finally, we've made it to the very last portion, and you're probably thinking, how in the world do I decide what Dr. Earl's going to ask about all this? Obviously, it's a passion of mine, and I probably gave you too much information, but maybe you'll find it helpful when you have a patient with CF on your rotations, or want to talk about this with somebody that has CF, or a parent or someone that you know. So what do I want you to know from these slides? What does a normal CFTR do, and what happens to it when someone has CF? What happens to the airway surface liquid in CF? How does hypertonic saline work? Why are pancreatic enzymes given in CF? What's the maximum dose of lipase that should be given? Be able to calculate this if I give you a case with a patient. I'm also give you a little handout on that. How many pancreatic enzymes should be dispensed for a month's supply? Be able to calculate for a specific given patient when told how many capsules per meal, and how many caps per snack, and how many meals and snacks they have daily. So remember, we're going to have 3 to 4 meals and 2 to 3 snacks usually. Usually a snack is half the dose of what you get for a meal. How do the new drugs work? All you have to be able to say is corrector, potentiator, and amplifiers, and what that means. And what counseling points do you need to be sure that patients know about these drugs? So remember, that's, you take it with a fatty meal, and also no CYP3A inducers, right? What's the pharmacist's role in cystic fibrosis patients? There's a slide reviewing this. Okay, so here's the slide. Make sure that they have their immunizations. Do you know the maximum dose of lipase? Are you sensitive when determining the number of enzymes dispensed? Do you know how to teach and evaluate nebulizer technique? Do you understand and can you explain the difference in kinetics in these patients? Do you know how to counsel patients on the new CFTR modulator drugs for CF? Be very cautious when giving cough suppressants to a CF patient. And this is something I don't think I mentioned till now, and I apologize about that, but I think it's sort of obvious. Don't give anything that causes a dehydration of secretions, right? So this is going to be any anticholinergic. Anything that dries up secretions is going to dry up that airway surface liquid even more, and that's really bad. These costs are very expensive for these new drugs. So that's not something that I'm going to teach you, but that's something that you will learn out in the field, is how do you assist in helping patients negotiate the cost of their medications. This is going to be a big issue for patients here. All right, and if I don't think I've forgotten anything, but I could have, and because I give you a lot of information here, but these are all important. So make sure cough suppressants are OTC, as you know, as are anticholinergics, that you want to make sure that the patients are very aware of the fact that these could cause problems with their CF. Okay, thank you so much for your attention and interest. Let me know if you have any questions or problems. Thanks so much. Bye-bye.